Hey guys, my name's Erica Tompkins. I am a registered nurse. I currently work at MUSC in Mullins or Marion. It's a small hospital. Everybody knows everybody. I work in the emergency room. I'm going on my second year there. In total, I'll be 3 years of working as a registered nurse, and all have been in the emergency department. My role as an RN in the emergency room, specifically, I am mostly the triage nurse and the charge nurse. So my role is to bring patients back, triage them, do a history, pretty much get their acuity level and assign them to their room and to their doctor. As a charge nurse, some things I have to be in charge of is just making sure the emergency room's flowing like it should. I have to stay on top of logs, keeping everything up to date and up to standard. So 3 years in nursing in the emergency room has been fun. I love the fast-paced environment. I am in the Francis Marion Nurse Practitioner program, so this is going to be my second semester. I'm a little nervous about this semester just because it's 3 classes and I'm still working full time, and I have a one-year-old at home, so it's a little nerve-wracking, but I'm excited. My career goal. So for my goals, I like to do them one at a time. I like to take everything 1 week at a time, one test at a time until I eventually get there. So right now my goal is going to be master's in nurse practitioner. That is my goal, and I'm sticking to it. When I get there, then my next goal will be DNP and so forth. But as of now, master's in nurse practitioner. My role as a nurse will change whenever my position changes, of course. So I'm going to be more responsible for patients. Instead of the doctors putting in orders, it's going to be me physically putting in orders. I'm going to be the one behind everything. So that's a little nervous, but I'm excited to learn how to correctly do it. As a registered nurse in the emergency room, we already place orders for doctors. There's some things that we already know what they would order, so we would go ahead and do it. So I'm excited to be able to expand my knowledge of orders and pathophysiology of just the human body and how to take care of different diseases and illnesses. So that's very exciting for me. And then nurse practitioner, I think it will help me better my community because the rural area that I work in, there's not a lot of health education. We have a lot of pregnant females that they don't have any health education at all, and it's scary. It's very dangerous, preeclampsia, and we have early preterm labor that come into the ER because they don't have someone that can sit down and tell them things to look out for. They don't have someone that can give them medications. So me becoming a family nurse practitioner in this area will be important, and it will help my community, I believe 100%, as long as I can get to their level and be able to patient educate my patients and get them to understand the importance of their health. I think it will be a very important role for me in community and my area. As far as leadership, once I do get my FNP, I would like to stay in my local hospital and maybe even get a new leadership role, maybe be on the committee or a board, anything like that, just because I love my hospital so much and I'm excited to further my career with them and as a nurse practitioner. Good luck to the semester, and thanks guys for watching.